Welcome to your anatomy. We are going to start by looking at our lumbar spine, our low back, our pelvis, and our hips. So these are our vertebrae, our lumbar vertebrae, and then in between are our discs. Here is our sacrum, and then our tailbone, our coccyx. Over on the side, our pelvis is going to be made up of our ilium, which blends into the pubic bone or the pubis, and the ischium, our sit bones. Now, between the ilium and the sacrum, we have our SI joint, or our sacroiliac joint. And then between our two pubic bones, we have our pubic symphysis. At those two areas, we typically see pain or discomfort during pregnancy, mainly because we're having our birth canal here widen. So it's going to put a lot of pressure in this area as well as the pubic bone, the pubic symphysis. So typically that is very common to have some pain there. It can be quite intense as well. Some women describe the pain between the pubic bones as lightning crotch because it's a very, very sharp pain in that area. Now, what we're going to do is start to add some muscles, but first I want to show what our pelvic floor is actually supporting. So this is our digestive tract. So we've got our large intestine, we've got our small intestine, and then we've got our rectum. So typically, we are going to talk about the rectum that's in the pelvic floor because that's going to be supported down at the pelvic floor. And then if I take that away, we're going to look at our urogenital, and that's going to be our bladder. It's going to be our uterus. So here's that. Okay, we've got our bladder down here, which is a muscle. And then we've got our uterus, we've got our fallopian tubes, and we've got our ovaries. Okay, again, all supported by our pelvic floor, which I will show here. So I'm going to start to add some muscles. Right here is our deepest layer of muscles. We've got our diaphragm up here, up in the chest, which is going to support our cardiovascular system, and then cardiovascular and pulmonary system. And then we've got our iliacus muscle. I'll talk about that briefly, our obturator externus, and the beginning of our adductors. Now, if we add another layer, that is where our pelvic floor is going to start to come in. Boom. So that pelvic floor right there from the bottom and the top, that is going to help keep our organs suspended and supported. Now, you can imagine if you are pregnant or becoming pregnant or have already given birth, there's very little room in there to allow for an expanding and growing baby. So of course, our organs get pushed up towards the top, and a lot of pressure gets put onto our little bladder. Bladder. And that's pretty intense. That is pretty intense. So continuing to add on some of those muscles, we've got our transverse abdominal muscle here. That is our deepest core muscle. So that muscle we want to be nice and strong. That's going to help kind of keep everything together and take some of the pressure off our rectus abdominal muscle that begins to separate at the linea alba here. So that's when we talk about diastasis recti. That is the separation of this tissue right here. We're going to continue to see the tissue separate. That is completely normal. What we want, though, is once we do give birth and we're going through postpartum, we do want this tissue to become stronger and to reduce that width between. But as you can see, the linea alba, the tissue comes down and actually is very much closely related to the tissue that's between our pubic symphysis and then, of course, into our pelvic floor. So you can see how interconnected all of that tissue is and why it's so important that we need to focus not only on the pelvic floor, but also the core. Now, we're going to flip this around and also talk about our glutes and why that's so important. So the glutes are not here yet, but we can see the backside of the pelvic floor and our coccygeus muscle. So that's all part of the pelvic floor. We're going to continue to add muscle here. Now we're getting into our smaller glutes and, of course, that piriformis or that pain in the butt muscle. That can be pretty intense. And then we continue to add the tissue for the glutes. But again, look how significant the relationship is between the tissues of the pelvic floor and the glutes as I add them on top. So reasons why we also need to focus on glute strength. And then here's the fascia of our thoracolumbar fascia, the fascia coming down from all these muscles in our thoracic and lumbar spine. Again, all of these tissues start to connect. So they need to be working together. But you can also see just how many muscles are attached to the pelvis that we don't normally discuss. They need to be balanced. They need to be strong, stable, mobile in order for our hip bones to also move properly. Okay, so just look at the layers of muscles as we build onto this. If we're having issues with one side versus the other, this can cause leg length discrepancies. So one of your hips might be tilted forward, one of your hips might be tilted back, one might be neutral, and one might be tilted. This is very common during pregnancy, mainly because there's so much laxity and those hips have a lot more movement. So this is just an intro to your anatomy so that you can start to really picture it and think about it as you have symptoms or just as you have questions so that you can advocate for yourself.